Thank you, everybody, for joining us. I'd first like to start by acknowledging that today, Marcel and myself and Gary Siegel, who's downtown in his office, we are all working on the ancestral and unceded Aboriginal territories of the Coast Salish peoples, including the Musqueam, the Squamish, and the Tsleil-Waututh, on whose territory I and my colleagues at Vancouver Coastal Health are working. And we are grateful to those who have tended the land from which we benefit today. So time really flies. So first, my name is Angela Chapman, President and CEO of the VGH and UBC Hospital Foundation. And I'm very proud to be the President and CEO in this, the 40th year, 40 years of incredible success. I stand on the shoulders of great people who have gone before me, both in terms of leadership of the foundation, but also in terms of our board. In terms of building up this foundation over 40 years. Peter Bentley, 40 years ago, was asked by the Premier of BC to form this foundation, at the time to raise money to purchase an ambulance, and that has since moved on to much bigger things than buying ambulances for service of the hospital, to include things like the new 16 ORs that we're building on the 3rd floor of the Jim Pattison Pavilion and all the changes that have gone on at UBC Hospital. Our hospital foundation is more than just a hospital foundation. We support projects across a span of activities both in the hospital and outside of the hospital, including at GF Strong Rehabilitation Center, Vancouver Community Health, and Vancouver Coastal Health Research Institute. Our mission is to inspire donors to transform healthcare and save lives. And in that mission, we have been blessed over the 40 years by incredible donors. Many of you who are on the webinar with us today have been there this entire 40 years, and some of you have joined us more recently, joined into our community of donors and supporters and past board members who are on the call today. I want to thank you all for being here to support this incredible mission, which has allowed us to innovate in healthcare and empower a constellation of projects, centers, and people who are advancing understanding of disease and illness and improving the health of individuals across BC in our specialized health that we provide for adults across British Columbia. We've had incredible impact over those 40 years, as I've said, and we're fortunate today to have some guest speakers who are going to share some of that story with you. It's amazing when you think back 40 years and the transformation that has gone on in so many parts of our lives. It's strange to talk about that in this year of COVID-19, when a tiny virus has brought us all grinding to a halt. It's amazing what advances have been made, and yet some things that have been with humanity for millennia continue to affect our lives every day. But it is amazing, and I think Dr. Marcel Dvorak will share some of that with you, some of those advances in technology. But one can sort of contemplate in the fact that we've been around for 40 years, what a transformation has gone on in society and what a transformation has gone on in medicine in those 40 years. So today, I'm delighted to say that we're joined by Dr. Marcel Dvorak, who is not only an orthopedic spinal surgeon here at VGH, but he also holds a senior position as Associate Senior Medical Director at VCH. We're joined by our new board chair, Gary Siegel, who's here today. A new board chair as of June. He became our next board chair. And we're also joined by Richie Biln and his wife, Kristen, who are going to give us the perspective of a patient, and we'll hear our patient story today. So without further ado, I'm going to just quickly introduce Gary Siegel a little bit more. Many of you may not know, but Gary Siegel's parents, Joseph and Rosalie Siegel, actually supported this foundation in its first year of existence way back then. So Gary has a very long, he and his family have a very long connection to this foundation. And Gary himself is very committed to medical advancement, not only here in our community, but around the world. And he's been a big supporter and champion of the work of Dr. Rick Hodes and Bring Back Hope initiative to support spinal care, or the care for individuals who have spinal deformities in Ethiopia, where it is highly prevalent. So without further ado, here is Gary to kick off our webinar today. Gary.
Well, thank you so much, Angela. Hi, everyone. For those of you who don't know me yet, I am Gary Siegel, and I do look forward to meeting you in person one day. In addition to being a principal and vice president at Kingswood Capital Corporation, I am extremely proud to be the board chair of VGH and UBC Hospital Foundation. It's both a privilege and a pleasure to be here with all of you today, celebrating this auspicious 40th anniversary of the establishment of the VGH UBC Hospital Foundation. I extend my heartfelt thanks to all of you wonderful and dedicated supporters of the foundation. Thank you for joining us. Like so many of you, my family and I have seen and experienced firsthand the impact of philanthropy. Believe me when I say that you are helping everyone in BC to receive the best adult health care, whether by supporting the purchase of critical equipment, funding high-impact research projects, or supporting advancements in patient care. Even now, during a global pandemic, supporting through donations of personal protective equipment or donations to help our essential frontline workers. You know, on a personal note, unexpectedly, I found myself admitted as a patient for my first time ever to VGH during the first 2 weeks of May. It was definitely an unusual time to experience hospital care during COVID times, but the commitment, dedication, and care of all the frontline and support personnel was obvious and impressive. I felt lucky to be there through those times, even though it was awkward not having family visits and things like that. We are indeed lucky to be here in Vancouver and have access to one of the best healthcare systems in the world. And a key reason that allows me to say that is your invaluable support. I do want to give a special shout out to Peter Bentley for being the founding chair some 40 years ago. And I thank you all for your vital contributions towards transforming healthcare and saving lives. And now it is with great pleasure that I introduce to you Dr. Marcel Dvorak, our renowned orthopedic spine surgeon, and more recently also our Associate Senior Medical Director at VGH. The same brilliant mind and surgical skills have brought recognition to our VGH spine department under his tutelage as being a world-class leading spine department are also being applied to the hospital as a whole. We are indeed lucky to have someone of the caliber of Marcel in our hospital, and he's representative of a general world-class quality of leadership that we have in the hospital, and medical surgeons and doctors of all kinds, and nurses and other support. So I invite Marcel now to talk about the significant transformation in healthcare over the past 40 years and to share the vision for the future and the impact of philanthropy and support from the foundation. Marcel, all yours.
Thank you so much, Gary. And it is an honor and a privilege to be here. And in the next 15 minutes or so, I'll just discuss a few of the changes that I've seen through my career. And to put it in perspective, a week from today marks the 40th anniversary of the day that I received a letter that when I came home from my summer job in Toronto, I was cutting grass at Sunnybrook Hospital. There was a letter on the kitchen table. It's from the University of Ottawa accepting me into medical school. I think, you know, August 15th I was the last person accepted into my med school class. So I have that dubious distinction. But my experiences go back to that time. And I just want to reflect on a couple of the changes and just highlight the magnitude of what has changed over the last 40 years. So, you know, we may not remember, but that was one of the covers of Rolling Stone magazine in 1980. 1980, there was another Trudeau in Ottawa and discussions with Alberta around energy policy. What you see above is a Mac 3, one of the state-of-the-art computers of 1980, and Ronald Reagan, I think, had just been elected in 1980. And, you know, it's interesting to think back to Steve Jobs in 1980, took Apple private. And I think you could buy an Apple share for something like $22. And if you bought 10 of those shares back in 1980, I think you'd be doing fairly well today. What you see to the right is one of the first MRIs that actually was used clinically for the first time in 1980 to identify a tumor in someone's lung. So we've come a long way just from a technological perspective. I'd like to frame some of my comments around what is really important to us. And by us, I mean us when we're either presenting to emergency with a healthcare crisis, or us when we're being wheeled into the hospital for an elective admission or elective surgical procedure or intervention. You know, what do we really care about? What is important, and what has changed around those things that are really important to us as patients, and those that we love who are also patients? Well, one of the first things that I think people would say is safety. They care about the safety of the environment that they're receiving care in, the safety of the procedures, the interventions, the environment. And I'd like to give a couple examples of how I think that has dramatically changed. In my first year in med school, I was in a situation similar to this physician. I was leaning over a patient who came to emerge, and he had acute abdominal pain, and he had an expanding pulsatile mass in his abdomen. I remember him very vividly for a number of reasons. But as I was in emerge, he gradually got sicker and sicker. His blood pressure dropped. We rushed him up to the operating room because he had what's called an abdominal aortic aneurysm, a swelling in his abdominal aorta, the largest blood vessel in the body. We rushed him up to the operating room, and the operation we did at that time involved opening up his abdomen, cutting out this big swollen area, and putting a graft in. And I remember the panic involved in that procedure, where we opened things up and there was this huge swollen artery full of blood pulsating through it. And the fact that the patient did not do that well because of the amount of blood loss and the complexity of the surgery, you know, the incision involved in doing that kind of surgery back in 1980 was substantial. And you can imagine how long it took to recover from this kind of surgery. Well, today, the same patient wheeled into emerge, exactly the same scenario. What would happen is he would go into our hybrid operating room where a catheter would be put in his groin. The extent of the incision is a puncture wound in his groin. And through that catheter, this stent is deployed across the artery. And that stent crosses the artery and doesn't require any open surgery at all. And given that, the ability to do that operation through a minimally invasive approach has reduced the mortality, the chance of dying, by half. So your survival rate is doubled by having this hybrid room, the endovascular technique done conjointly by vascular surgeons and by radiologists and the whole perioperative team in this unique high-tech environment. So technology has made the hospital safer. It's made it a safer and better place. And innovation, both in anesthesia, critical care, the ability to keep the patient alive while we rush them up there, the hybrid operating room that, as you know, is funded fully by philanthropic contributions from several galas and very significant personal contributions from many of our supporters. Without that, we wouldn't have this safe environment that makes it actually really does save lives. We could count the number of lives that have been saved by this kind of innovation. The next thing that I think people are concerned about or think about substantially is, how long will I be in hospital? What will my recovery be like? How quickly will I get back to my activities? Should I buy a ski pass for Whistler for next season? And in our current environment, I think we're getting people back to activity faster than ever. And everyone knows what this refers to. It's on the back of every ambulance, the, you know, FAST moniker that is the quick sort of way of identifying whether or not you have a stroke. Now, back in 1980, when I was in medical school, a stroke was something that happened, and then we kind of nursed people through their recovery. And we really didn't have much that we could do for someone with a stroke. It was kind of viewed as an act of God and a terrible thing. And, you know, we wondered how severe it would be and whether the patient would get any recovery. But today there are new techniques where what you see at the top is an angiogram where dye is squirted into the arteries in the brain, and you can see the clot on the left and in the middle image, and then on the right image you can see that the clot has been removed. And it started by us injecting dissolving substances like TPA into arteries to dissolve clot, and then most recently we've used what's called mechanical thrombectomy, and this is a new technique that has developed and has just taken off. And at VGH, there are cases of people who've come in with a severe stroke, almost unresponsive. They're rushed quickly into a very high-tech angiography suite where radiologists and neurosurgeons put these catheters and coils up into the artery, and they literally unplug the artery, kind of like the neurosurgical equivalent of a roto-rooter. And they literally pull out these things that look like large earthworms. And remarkably, I've talked to a couple patients who literally wake up and sit up after this and pretty much walk off the table feeling immediately better because suddenly the perfusion is restored to their brain. And this again is recovery that is expedited. It gets people home much more quickly. It minimizes disability. It allows them to get the most out of their rehab. And in that area and in many other areas, we've seen huge advances. This is an x-ray of a woman that I treated in my first year of practice. She had rheumatoid arthritis, and I actually went away to Europe to train to study how to do spine operations. And one of the reasons was that we had a rheumatoid clinic where we would see patients with rheumatoid arthritis and ankylosing spondylitis and other types of severe arthritis that would just so disable them and their neck would crumble. And I don't know if you can see it well, but many vertebrae are destroyed in her neck. And this was a common thing. I would probably every couple weeks, I would operate on someone with rheumatoid arthritis. And now with the new medical therapies, we call them biologics, you know, drugs such as Enbrel and Remicade and Humira, you know, these drugs have radically changed practice. I don't see rheumatoid patients anymore for surgery. I think in the last year, I've maybe operated on one patient with rheumatoid arthritis. And so the treatment of these inflammatory arthritides is just so dramatically better today because the medical advances and medications we have available. In my practice, which is sort of spine deformity scoliosis surgery, this was the state of the art back in the 1980s, a Harrington rod, and there were just newer rods starting to come out in the early 80s. But a Harrington rod like this would mean you would be in a striker bed, and these beds that would sandwich the patient and flip them back and forth, and you would be immobilized in those beds for literally months. And so I remember a patient that I operated on early on in my practice who literally spent 6 months in hospital between the surgery, the post-surgical rehab, and then the rehab at GF Strong. Whereas today, we take that same patient, and this is a pre and post-op x-ray of a woman who's a lawyer in town, and we can stabilize the scoliosis. And her length of stay in hospital was about 2.5 weeks, and she went home walking, able to go up and down a flight of stairs. Now, there were some limitations for the first month or two after surgery to let things heal, but her recovery was remarkable. And really, the way that we can do that kind of surgery is with technical innovations like this. This is an image of an operating room with what's called the O-arm. It's an intraoperative CT scanner that allows you, like a video game, to guide and insert screws into the spine very safely. And it was a donation, again, from Philanthropy, and it was Gary's father who turned to me one day while we were having lunch at the U restaurant and said, "What would make your life easier tomorrow?" And I described this technology to him, and without skipping a beat, he said, "I'll buy you one." And so within about 6 months, we had an O-arm, and it's revolutionized our practice. It's pretty much gotten rid of things like the halo. We can now fix fractures in very delicate areas of the spine by very precisely inserting screws and stabilizing them. So the take-home lesson number 2 is return to activity is really much improved through all of the technological advances in medical care and in surgical care. And the last area I'll talk about is the role of technology in dealing with wait lists. You know, we often think that medicine just gets more and more expensive and people are waiting longer, but really technology is the answer to ensure timely access to care, because it shortens the amount of time people are in bed and in hospital. This is the way a fracture of the femur, you know, the largest solid bone in the body, the thigh bone. If you had a fracture of the femur, you were put in traction, then you were in a cast. Your hospital stay was somewhere around 6 months. And the complication rate was very high. And around the time I started my residency, there was this innovation of putting nails in across these fractures. And again, that allowed the length of stay to be reduced to today. If you have an isolated femur fracture, it's nailed, you go home in about 3 days or so, and many patients can start walking and weight bearing. So in healthcare, we've been faced by clinical problems. We've looked for solutions in biological solutions, whether it's in biological labs, whether it's medical solutions. We've partnered with biomechanical engineers and biomedical engineers, and we've then come up with these technological therapeutic interventions. And really, VGH and UBC hospitals and the foundation that supports a lot of the innovation and a lot of this work has been central in this virtuous cycle of continuous improvement. And you see it in transplant, in epilepsy, in the prostate center, in all these areas, the whole ECMO service and critical care, and in the radiology department where they're doing these thrombectomies. So multiple examples of that virtuous cycle. And so when I think of the foundation and its importance, I think of the struggle that we have, that this nexus of ever increasing technology and ever increasing demand by aging society, right? It creates this possible prospect of limitless expenditure, and really that's incompatible with a solely publicly funded system. But I think that the role of philanthropy has been to provide that very targeted and strategic investment in areas where we really can use technology to shorten length of stay, improve outcomes, reduce reliance on hospital beds, minimize the amount of rehabilitation needed. And so the VGH and UBC Hospital Foundation has had a huge impact in giving physicians the tools that they need to make the system more sustainable, more accessible, and better outcomes with improved safety. So maybe what I'll do is I'll just stop there. I think I'm near my time limit, but really the role of philanthropy at multiple different levels has been extremely dramatic and profound. And, you know, I see it in so many areas in the hospital. So thank you to not just the donors, but also those that work and have worked and have led the foundation, and the foundation board members who so selflessly donate so much time to galas, to activities, to organizing. So thank you.
Thank you, Marcel. That is a tremendous overview that is really kind of unique to the positions that you hold as both a surgeon, a hospital administrator, and as a director on our board of directors. You really brought the whole thing together. And I think we can see in the span of those 40 years, the move for greater safety, less invasive surgery, Personalized medicine, you touched on a little bit with the arthritis medicines. The technology that has advanced over this time, from medical imaging to robots, and now, as we know, more and more machine learning. So we see in all of those things places where the foundation has played a role. Thank you so much for that overview rather. My oversight was that I forgot some of my speaking notes in the beginning, so I do apologize to everyone, because I was supposed to let everyone know that we will be having a question and answer period at the end of this, and to hold off on your questions for now, but please use the chat. The chat box is there, question chat box for you anytime. And I don't see that there really is very much there yet. So this is the prompt for everybody in our audience to add in your questions, and we will be coming to those shortly. And so with that, I think I have covered off what I was supposed to have said before, and we'll now turn to a very intriguing, interesting patient story. And I'm delighted that we have Kristen Biln with us today, who will give us some personal insight. Before I jump to that though, let me just give you a bit of background on this. In January 2017, a then 30-year-old Richie Biln experienced a devastating and life-changing accident. When he was riding his snowmobile in the backcountry of Squamish, where they live, it crashed down 30 feet and on impact cracked his back on a metal bracket of his snowmobile. This damage left Richie unable to move in the freezing snow. We will now show a video that tells the rest of the story.
Hello everyone, my name is Richie Biln, and in January 2017, I had a terrible accident. We went out for a normal ride like we've been doing for the last, I guess, 4 years prior to the accident. Once we reached the summit where our cabins were located, it was about a 5 to 10 minute ride to where everything went sideways. When I saw the cliff coming up, I had to decide to either jump off the machine or ride it to the bottom. I jumped off the machine, but I guess it was too late. When I landed on top of the machine. No, I couldn't move. Either jump off the machine or the worst pain I've ever felt in my life. I jumped off just the machine, all the nerves. It was too late. When I landed on top of the machine. The crash. No, I couldn't move. They were putting like, and it was just the worst blankets on top of me, and every time they put a new blanket on top of just all the nerves, the pile, I could feel everything. I remember asking, when is somebody going to come help me, or I might have been asking every 2 minutes, but it felt like a lifetime. I just remember everything going very fast and smooth. Like, I don't remember waiting for anybody. All the care that I got at VGH was exceptional. There was never a moment where no one took care of me. We just went day by day. I just kept getting better and better and better. Fully recovered, probably, I'd say walking stage 5 months. And then fully recovered, I'd say a year. Well, I got married about a year later, and I have a baby girl that's 1.5 years old now. So life's been pretty good to me. You never know what's going to happen. If you're going to the grocery store or snowmobiling like I did, anything could happen at any moment. Thank you to the healthcare teams at VGH for saving me. And thank you to the donors of VGH and UBC Hospital Foundations. Your support enables world-class physicians like my surgeon, Dr. Brian Kwan, to have the tools, resources, and equipment to do what they do best, and that's save lives. I'm living proof of that. Thank you.
An amazing story of incredible specialized care that's delivered here at VGH, and an amazing story of recovery, and very touching story. We are joined today by Kristen, who is Richie's spouse, as you saw in the picture there. And there she is. Wonderful. Great. Well, how are you doing today?
We are all doing really amazing. Thank you so much for allowing Richie to share his story. It's still super emotional, even 3.5 years later, that's for sure. But we are so grateful for everything that VGH and the teams did for us.
Thank you. And I hate to put you through reliving those moments again. That is quite difficult. I know these things are very life transforming for sure. We're really delighted that he is now fully recovered and that you're all doing well. Tell us a little bit about that experience, that time, and what kind of care you did get at VGH.
In Squamish that day when he went up snowmobiling, and I decided to go back where I was currently living in Vancouver, do my grocery shopping and all that good stuff for the week. And he went up the mountain, and it must have only been probably an hour and a half before I got the phone call from his brother saying, something happened, you got to come back quickly. So I dropped everything I was doing at Save On Foods and rushed back to Squamish. And by the time I got back, it was probably about an hour and a half. So I went immediately to the Squamish General Hospital thinking that's where he would be. But unfortunately, as he said in the video, it took about 3.5 hours to get him off the mountain. Once he got off the mountain, he was transferred to Squamish General, and they did their original, or I guess, immediate assessment. He was then transferred to Lions Gate, where they found out it was a spinal cord injury. And within 5 minutes of him coming out of the testing for that, he was then transferred to VGH. So it all happened relatively quickly, but almost felt like it was time was standing still. So once we got to VGH, I can say he went directly into the trauma part of the emergency, where they immediately jumped into action, no questions asked, kept me completely informed. Given it was almost, I would say, almost midnight at that point, I think everybody was running on fumes in my family, not really sure what was going on at this point. And then along came Dr. Kwan, I think at like 2:30 in the morning, and he just took over. He was absolutely amazing, outlined what everything would look for us going into surgery in the morning. I guess it was the morning, but at 8 he was supposed to go in. And yeah, it was just a very surreal experience, something you would never wish on anybody, but the team definitely did a phenomenal job.
Wonderful. And the recovery, he was in hospital, I imagine, for a while as part of that recovery. And then going home, what did that recovery also look like?
So the recovery in the hospital was pretty amazing to see it kind of play out each day. Each day was very different than the last day. And he not only broke his back and had the rods and pins in his back, he actually had extreme nerve damage that transformed into his legs, into his stomach, and into his legs. So even putting a blanket on him made it really difficult. He still describes it that he felt like the nerves were outside of his body. So recovery was interesting each day. The team was, I can't even describe how amazing the team was. They were patient, but they challenged him every single day. I believe the physiotherapists were in his room 2 to 3 times a day at the start, and then upwards of 5 times a day when we were almost being ready to be discharged. So it was definitely challenging, but we all remember the first time he took his first steps, and it was not something we anticipated to happen, especially as early as it happened. So once we got home, the therapy continued, the progress continued, and yeah, it was just pretty incredible to watch.
Wow, that is just incredible. And now you have a beautiful daughter.
We do, yeah, she's 18 months. And yeah, our life has changed significantly, and we kind of look at all the things that went into making it happen, and we're just grateful every single day.
Fantastic. And Richie can't be with us today because he's off working. So we're sorry he couldn't be with us, but totally understand that. It's amazing to hear your story. And I think it brings out, you know, another side, not only the patient experience and what you went through, but you really put an emphasis on the people that were involved, from the surgeon, but then all the allied health professionals and the delivery of health care back in your community, which are so important. It's a whole continuum, and Richie's story really illustrates that. Well, I really honestly wish you and your family the very best and continued health and healing to you in this rather peculiar year.
Yes, definitely.
Wonderful to have you with us. So I think what we'll do now is we will open it up to questions and answers. And I think we have a couple of questions, but I'm also just going to check and see. We do have a question here. And I think what we'll do is maybe if, I think Gabrielle, who is behind the scenes here, is going to maybe put us all in the picture. There we go. Marcel is back on. Terrific. So Marcel, knowing Richie's story, what would that care have been like 20 years ago, or even maybe 40 years ago when we all started back in 1980?
You know, it's interesting listening to Kristen and listening to Richie's story, because it highlights to me what we have today and what we didn't have 40 years ago. And, you know, we talk about our healthcare system, but those are like three very precise words. There's health, there's care, and then there's the system. And Kristen really referred to all three of those, right? So, you know, Richie's health, he had a broken back, he had a spinal cord injury. We can try to fix that. We can fix the bones. We can create an environment around the spinal cord and nerves so that they recover, so that that neuropathic pain gets better, and we can measure those outcomes. And we know that today we are much, much better at restoring function, at getting people back to a state of health than we were 40 years ago. So that's a measurable sort of attempt to cure or fix injuries, and that's the health part. The care part is something that we equally focus on. And I think Kristen was very eloquent in how she described the care she received from the nurses, the physiotherapists, the team. And it is a team. It's not just the, you know, the surgeon who does the work and then walks away. It's the entire care team that provides that care in all the areas of the hospital. And care really means that we are responsive to the patient's preference, their personal preference. Care means that where we can't cure, like we may not have been able to take away all of that nerve pain in Richie's legs, but we provide compassion, we provide care where we can't cure. And that providing care actually gives you better measurable outcomes in the health side of things. And then the final thing that she alluded to that I think is very dramatic is the system. So it's a healthcare system, and the system elements of it start with, you know, the call from the mountain and the extraction team, the search and rescue, the coordination between that and the EHS and the ambulance and the air ambulance and all the different transfers that were involved. And, you know, I see them from my office landing on the roof of VGH daily. And then it goes beyond that into the broader trauma system of care, where VGH is a level 1 trauma center for the province. And there are these subspecialized areas of care, so that 40 years ago, there might have been a surgeon who did a little bit of orthopedics or a little bit of neurosurgery, and then happened to take care of spine injured patients at the end of the day. There really wasn't the degree of subspecialization in the system that we have today. And today we've got dedicated subspecialty services with providers, both, you know, on the medical side. We've got a stroke service, we got spine service, we've got all these dedicated subspecialty units that really create that system. So what we have today is a healthcare system. Back then, we really didn't have many of the elements of that.
Mm-hmm. Wow. So there's a number of questions that are coming from the audience. Some have come before and some are coming in now. One that has just come in now: where will the future innovations in surgery come from? And I kind of alluded to one when I was just summing up what you said. Could you speak a little bit to kind of machine learning and artificial intelligence and how that's maybe going to impact the next decade or two of surgery?
Yeah, so it absolutely will have a significant impact. You know, we collect so much information about patients, and we're drowning in data and information about patients, whether it's on their biological profile, whether it's the unique ability to image things on MRIs and different advanced imaging modalities. And that's where I think machine learning and artificial intelligence will be able to help us to move towards identifying different cohorts of patients, so that one of the difficulties we face is that we talk about a spinal cord injury, we talk about diabetes, or we talk about stroke, or we talk about all these different things, and we clump them into one category. But actually, they're very heterogeneous. There are many different levels and many different types, and they probably should all be treated differently. And maybe one of the treatment that we apply to a certain type of diabetes won't work for another type of diabetes in a different kind of patient. And it's the use of all of that data in a creative way to create personalized treatment for people with unique genetic profiles, with unique patterns of disease, with unique biology, that is going to really create a massive, massive advance. And the first place we're seeing it, I think, is in areas like, you know, we've got a leukemia bone marrow transplant unit, and they are starting to look at immunotherapy for certain types of lymphomas that don't respond to the current treatments that we have. And those very targeted specific treatments to specific tumors make a huge difference. There's a variant of lung cancer now that we've identified through genetic profiling that has a way better prognosis than all of the other lung cancers that we sort of clump together. And by pulling out this unique subpopulation of lung cancers, we can direct personalized treatment to them and get amazingly better outcomes. We see it in prostate cancer as well. People that, you know, have widely metastatic prostate cancer, but then because they are identified with a certain profile, they get a very specific therapy, and lo and behold, they do better. You know, Lance Armstrong is probably a great example of that, with his testicular cancer that was metastatic to the point where he had metastases. He had cancer spread to his brain. And, you know, through very precise treatments, he had a great outcome.
Thank you. So personalized medicine and of course, machine learning has a big role in that. Since the pandemic started, COVID-19 has really accelerated virtual health. How do you see virtual health moving forward? And I think specifically, I bet you people would be curious, how would it apply to surgery, if at all?
Oh, it's very relevant to surgery, you know. So you always have to look people in the eye and make that personal connection with people, particularly when you're seeing people for you know, making a decision around an elective operation. You really have to have a sense of who you're talking to, the personality of the individual, what their goals and expectations are, what their level of anxiety is. I even find that more difficult today when, you know, we're all in the clinic and we're all like this. You really lose the sense of, am I happy and smiling, or am I, you know, really anxious? So that has to continue. But we operate on people, and then we send them back to Prince George or Tumbler Ridge or somewhere far away, and then they need follow-up. And usually the follow-up is a relatively straightforward thing. We want to check an X-ray. We want to make sure their wound is healed. And I've had patients drive 10 hours down to Vancouver to my clinic to have a follow-up that really literally takes 10 or 15 minutes. And I think much of that will be replaced by virtual health, by telemedicine, and much of the follow-up, so that if we think someone has a certain pathology, we order an MRI. The MRI can be done in Prince George. I can then phone the person, get them on the phone or get them on Zoom or WebEx, and I can talk to them. I can look them in the eye, and I can explain. I can screen share and show them the images. And if I don't feel the need to actually physically examine them again, we can probably just go ahead with planning their treatment without making them come down. So I think it's going to revolutionize how care is provided. It's going to be more responsive to patients, and I think better for everyone. It's going to add capacity to the system.
Yeah, and the adage that's used in Vancouver Community Health is home is best. If you are at home, the faster you're at home, the more you're surrounded by those that care for you, but you have to be home safely. And that's really what you're talking about.
Absolutely, yeah.
Okay, I'm going to shift it a little bit, but now as we think about the backlog in surgery that we currently have, how are we managing with the backlog on surgeries? And there is a specific question about the private sector and if they've been asked to get involved in dealing with the backlog.
Yeah, so I mean, that's a good question, and it's uppermost in a lot of people's minds. We have a backlog in the whole system, right? Like, you can't just have surgery. You have to see people. You have to have a diagnosis made. You may need investigations like CT, MRI, ultrasound, angiograms, all those different things, and they would precede the decision to even get on the surgical wait list. So all of those parts of the hospital were paused during COVID for a very good reason, and very appropriately. And now we are working to expand all of that pipeline. So it's like a long garden hose. It isn't just the water that comes out the end, right? It's the long hose and where it starts from. And different parts of the hose can have people stepping on it and stopping the flow or taking their feet off it. And what we've done is we've expanded time in CT scan, we've expanded hours in MR, we've tried to facilitate getting patients through all of those diagnostic modalities so that they can get in to see their surgeons, can get appropriate treatment recommendations. And then we've also done the same in the operating room. So, as you know, with the help of many, many donors and the help of the foundation, we are on target and on budget to open 16 brand new operating rooms on the 3rd floor of Laurel Street Pavilion. And we're projecting that those will be in play and they will be open and functioning as early as April of 2021. So that's early next calendar year. And that will make a dramatic difference in our capacity. We're going to go from the number of rooms we currently run and expand incrementally up to probably at VGH running up to 24 operating rooms, where currently we've been running 18, 17 at the best of times. So it's going to be a dramatic response to the need to catch up and then to keep up. And then the last thing is the role of private clinics. And this is a hotly debated issue in media and publicly. But what the health authority has done and what the Ministry of Health and province has done is they've said, look, those are operating rooms, they're sitting there, let's use them. And we have purchased time at False Creek and ASC to private clinics locally, and we have purchased time so people can have their publicly funded provided by surgeons that are VGH UBC surgeons. They can have their surgery done at those private centers within the public healthcare system, funded by public health, just provided in that private environment.
So are you you know, quite content in terms of how we're doing with that backlog and how things are moving along? Is there, would you say we've made good progress? I mean, it's been amazing to me this year, I have to say, and I think we've all made this remark, just how quickly everything changed and the response to COVID-19 to be ready for COVID-19, like how quickly what we think sometimes is a big system and difficult to move could move quickly. So now as we shift back and we get those surgeries back up, are you seeing the same thing? We've moved quickly and we're addressing the backlog well.
It's so much easier to turn things off than turn them on, right?
Right.
To be perfectly honest, you know, the ramp down and shutdown occurred just so quickly, and in a response to a crisis, and it was amazing what we were able to do to create that COVID capacity. And then what we've tried to do in building back is not to just go back to the way things were, right? That would be a mistake. It would be a lost opportunity, because probably the way things were was missing a couple key groups and a couple key populations that are maybe underserviced or don't get access or don't have the kind of access to surgical care that they should have. So what we've tried to do is we've tried to look across the system and look regionally as well, and say, well, these are the things that we need to build back. These are the most important things. So the first thing we built back was cancer surgery. Mm-hmm. You know, anyone with a cancer that is progressing, where there's a time-dependent window in which we can operate and get a really good outcome, maybe even a cure, we prioritize those. Any of the really urgent emergent surgeries, we prioritize those. And it's, I mean, I feel quite proud of the surgeons and the nurses and the anesthesiologists, the whole team in perioperative care, that allowed us to keep up with a lot of that urgent, emergent, and oncology cancer surgery. So we did quite well for that. For some of the elective procedures, it took us a while to start to build that back. But what we're doing is we're being very strategic, very careful, and we are protecting those urgent emergent things as sort of the platform of surgery that we have to do and have to take care of, you know, first and foremost. And then we are now adding on the elective procedures, the ones that, you know, are very, very high value. So, you know, a hip or knee replacement is extremely high value to someone with hip and knee osteoarthritis who can't get up their stairs to get to their bedroom. And those are really important things to start to add back. And then the lesser appreciated things that are, you know, smaller populations, more unique populations, but are equally disabling and keep people from going to work, keep people from caring for their kids, keep people from being able to exercise and participate in a full life. So we're trying to assess those things that are most valuable to the populations, to which populations, make sure they're equitably accessed by people, and then build them back strategically. And I'm optimistic. I think that we will, with the new operating rooms and with, you know, some expanded capacity. We're talking about running rooms on Saturdays, using the private clinics. There are all sorts of opportunities we have to build back to a level where, you know, we can keep up after we've caught up.
Excellent. Well, thank you, Marcel. We really have come to the end of our time here, but I want to thank you so much for such an insightful overview, both of the 40 years, how we're dealing with this COVID-19 and how we're moving beyond it this year. Thank you so much. It is really a celebration of the 40 years that we've been through. And looking forward, it's kind of hard to imagine 40 years from now, but certainly within the next year and few years, we've got a bit of insight about the trends and where things are moving. Thank you so much for that, Marcel, and I want to thank Gary Siegel as well for being with us today and kicking it off, and Kristen Bilm for sharing her and Richie's story of trauma and recovery from that trauma, and the intervention that VGH played in that, and Dr. Brian Kwan. We're so grateful to our healthcare frontline workers. I do want to say that on behalf of everybody who's on the call. And I want to say thank you to all of you who are on this call. Thank you for attending. Thank you for being part of the success of our 40-year journey. 40 years, $1 billion of impact on healthcare. It is something to celebrate, and I'm truly grateful to you all. Thank you for helping transform healthcare for the benefit of all British Columbians. We look forward to your feedback on this event. Please feel free to reach out to us at the Foundation with any questions you might have. Questions for Marcel as well, and for Gary, we'd be happy to pass on. I hope that you and your families stay well and keep safe. Thank you all for joining us today. Have a wonderful rest of your day. Thank you.